We would like to have the opportunities to view the philosophy of caring a person as a whole. So it's not only taking care of their mind, but also their body. Hong Fook Mental Health Association was established in 30 years ago, and at that time it's a group of Asian professionals, including psychiatrists and social workers and nurses. Hong Fook in Chinese means health and wellness. So we really, I think that's a very important element of health, and also it's important that because of stigma, that people hesitate to say mental health or mental illness. They would talk about health in general. So Hong Fook is health and wellness. And so the new projects we are doing is we are hoping to expand the target of our clients, and other than taking care of the individuals, their minds, we are also focusing on the whole person, including the primary care. So this is going to be a new addition to Hong Fook. We will be developing the clinic. It's called HF Connecting Health Nurse Practitioner-led Clinic. A lot of our consumers or clients, they have been on antipsychotic medications for a long time. They develop different forms of metabolic issues. But not a lot of our clients, they have access to primary care. They may go to the walk-in clinic, or they may just think they have seen their psychiatrist. That means they have all that medical care. An opportunity come up from the Ministry of Health in Ontario. They have a call for proposals to establish family health teams and also nurse practitioner-led clinics to improve the primary care for all Ontarians. We also have a lot of community partners. They were informed that when we do this submission for the nurse practitioner-led clinic, we actually get 35 organization support for this clinic. So they're excited having us to get open. We are confident that we will get probably referrals from for a lot of our partner agencies, hospitals, and even internal, that we have clients and their family members. Don't forget they have families too. So I think that we gradually will build up the caseload. And we also are anticipating most of the new patients will be from Asian background and immigrants. So that will be our focus. We want to address the social determinants of health, to look at issues of poverty, access, language barriers. So we'll try to meet those needs. For any new patients come to the clinic, my just imagination, because we haven't started yet, we will have a triage component that will be done by the registered nurse, and we think that if there might be an opportunity, we identify whether there's any issues related to social determinants of health, that because of poverty or because of any stress issues, that person may get benefit from having a counseling session with a social worker, or there's issues about food or access, or then we probably connect with a dietitian. But if there's issues more profound, with more like issues like depression, is clinically depressed, so we will see maybe we can obtain psychiatrist consultation for this particular client, and that this person may need case management services. Then this person may be referred to Hong Fook, because it's a mental health service agency. So we will try to speedize the process, so the person still under the same roof, they can get all the services and they don't need to be referred out. Personally, I think because I have a long work history in the community health, I work in a community health center in downtown Toronto for over 17 years. And then I have moved on to do a lot more work in mental health sector, whereby it's with the assertive community treatment team. So my advice to whoever who's watching this video, I would like to share a couple of key messages. One is I think we need to believe, a strong believer in collaborative, because I don't think one person can do everything. And it is good to build our knowledge and share the same challenges or share our resources together. We will build a community. So I think one thing is collaboration is very important. Secondly, I think we need to look at a person as a whole. It's holistic health, because your physical health can affect your mental health. Your mental health also will have issues of physical health problems. So they are very much interrelated. So when we provide care for people, I will really strongly recommend to focus on holistic health, holistic care, and continuum of services is very important.